Why is creatine kinase important for muscular dystrophy diagnosis? Imagine a tiny enzyme inside your muscles that acts like a warning bell when your muscles get damaged. That enzyme is called creatine kinase. It normally stays inside muscle cells, helping produce energy for movement. But when muscles break down, as in muscular dystrophy, creatine kinase leaks out into the bloodstream. This causes blood levels of creatine kinase to rise significantly. In muscular dystrophy, especially Duchenne muscular dystrophy, the problem begins with a missing or defective protein called dystrophin. Dystrophin helps keep muscle fibers stable and intact. Without it, muscle fibers become fragile and tear easily during everyday activities. These tears allow creatine kinase to escape from inside the muscle cells into the blood, leading to elevated levels. Usually, normal creatine kinase levels are below 200 units per liter, but in muscular dystrophy, levels can be 10 to 100 times higher. This makes creatine kinase a very sensitive marker for muscle damage. Doctors use blood tests to measure creatine kinase levels as an initial step when they suspect muscular dystrophy. A high level suggests muscle damage but does not tell which type of muscular dystrophy a person has. It helps distinguish muscle problems from nerve-related conditions, where creatine kinase levels often stay normal. For example, spinal muscular atrophy usually does not cause elevated creatine kinase. Once elevated creatine kinase is detected, further tests are needed to confirm the diagnosis. These include genetic testing to look for specific mutations and muscle biopsies to examine muscle tissue directly. Creatine kinase levels can also help doctors monitor how the disease progresses over time. In Duchenne muscular dystrophy, for instance, rising or falling creatine kinase levels can reflect changes in muscle health and respiratory function. Since muscle weakness can affect breathing and heart function, tracking creatine kinase can give clues about respiratory and cardiac symptoms, which are common in advanced stages. In summary, creatine kinase is a vital part of diagnosing muscular dystrophy because it acts as an early warning sign of muscle damage. It helps differentiate muscular dystrophy from other neuromuscular disorders, guides further testing, and can even provide insight into how the disease is affecting muscles involved in breathing and heart function. Always remember, if you or someone you know shows signs of muscle weakness or fatigue, consulting a healthcare professional is essential for personalized assessment and care.